obnoxious. You know, we look at those pictures in movies and we see the woman delightfully sleeping with her eyes shut and her mouth in a little curved up position, and we think, how lovely. And then all of a sudden, the snore. How unhealthy. How unsexy, but really unhealthy. Let's talk about snoring and why we hear the air movement kind of get caught up in your throat. Well, the bad news is that this is to some degree about the aging process. Isn't everything about aging? All these muscles in your neck that help keep the jaw open and keep the air moving easily down into your lungs, that kind of goes away as we get older. And it's not just that your neck is saggy and you're looking at your skin dragging along the sidewalk, but in addition to that, all those muscles are saggy. And so the opportunity for the air to cleanly move in the back of the throat is diminished as those muscles really close down the airway passage and you hear a person breathe. Snoring, or the movement of the sound of air, is very similar to hearing someone have what we call a bruit, or the sound of flow in your neck. Or think of a river. When do you hear the river make noise? After a rainstorm, when there's more water that's flowing, and or when there's some obstruction to that flow, so that you hear a greater amount of flow through that small duct. So snoring is about the movement, the hearing the movement of air. What to do about it? Well, ask your doctor. The most common reason, as I said, is some type of obstruction, and that could be cleared by a couple of major apparatuses. One of them is actually a dental device, where they put a dental device into your mandible and move your chin up. You know, we're always telling you chin up. Well, in this case, that chin up can actually take away that noise so that once again the air moves freely. Secondly, we have machines called CPAP machines. CPAP machines are positive airway pressure machines that actually blow air down into that windpipe, if you will, down through the trachea and keep the airway open. Again, this is all about the free movement of air. And snoring is just a noise that you make when the air is not moving so freely. So it's not sexy, true, but mostly it may not be healthy. And the important thing is that when that happens, and I don't mean to scare you, but indeed we do think that what we call sleep apnea, which is associated with this snoring, can be the cause of hypertension, some major heart disease, sometimes even stroke. So it is conducive for you to check it out with your doctor, and it's easy to take care of. Think if you can just get a little device, keep your chin up, and sleep sexier.